Welcome to our study series. So today I'm taking you through cytology. So cytology is the branch of histopathology that majorly deals with the study of cells, study of their morphology, and majorly in order to guide treatment and identification of other infections that have invaded our cells. So in so doing, you'll find infections that can be diagnosed through this procedure, can actually involve cancers, can also involve infections like maybe bacterial infections, parasitic infections, and any other infections that majorly infect our cells. So, example of specimen that we use in cytology laboratory in order to diagnose these conditions majorly can be like blood is one of those cytological specimens that we use. We can also use specimens like sputum in order to diagnose these patients' conditions. We also go ahead and use what they call nipple discharges can also be used. We can also use synovial fluids in order to diagnose. We can also use CSF in diagnosis. Then we can also go ahead and use cervical vaginal smears. We can call them the pap smears. Those could be the major ones. Then, of course, we can also find peritoneal fluids, pericardial fluids, and pleural fluids. All those can be obtained by those cavities respectively. So those could be examples of those specimens that we can actually obtain to use in the study of the cells. Ways through which these major specimens can be obtained from one's body. Now, let me give you the majorly two procedures through which these specimens can be obtained from the patient. One of them is what they call exfoliative method or exfoliative procedure. Now, using exfoliative method, you realize that patients' samples, like fluid samples, come together with the cells. For example, urine samples, they come up with some epithelial tissue. So if you want to study some cancers or some other abnormalities inside the urethra or up to the bladder, we can obtain this urine and sediment it and majorly perform these cytological procedures in order to analyze the morphological appearance of the cells or any other abnormality located along that area. Then we can also go ahead and do what we call the invasive procedures. Under the invasive procedures, these are manual procedures that doctors employ in order to obtain these samples from patients. For example, the major one that we do is what they call the fine needle aspiration. Fine needle aspiration can be used for obtaining pleural fluids, can also be used for obtaining pericardial fluids, can also be used for obtaining CSF, can also be used for obtaining synovial fluids. It can also be used for, of course, obtaining blood for this patient. That's fine needle aspiration. So a fine needle is actually inserted maybe by guided ultrasound or sometimes just by any other protocol used. Then this can be obtained and majorly used for diagnosing a patient's condition. Then on the other hand, we can also do what they call ablation. Ablation is where a medical doctor or a medical personnel uses some specialized brushes in the histopathology department in order to obtain these samples from the patient. For example, when you're going to obtain a high vaginal swab, you can get well-designed gauze-like swab. Then, of course, you're going to rotate it a little on the cervical region or the high vaginal region. Then you obtain these cells, and finally, you go further in studying them. That's how you're going to obtain this. Then you need to realize that in the cytological studies, we are going to prepare cytological smears. So we are going to prepare a smear on the slide and possibly examine and come up with the right diagnosis for our patients. So allow me to take you through the smear preparatory techniques in cytology department. One of them is called the smash or crush technique. With the smash or crush technique, you realize that you can have two slides. For example, you can have your two slides like this. So what you're going to do, one slide like this, you're going to obtain the sample, which is like a drop from a patient's major specimen. You're going to obtain some small, then you're going to drop on this slide. After dropping on this slide, you're going to obtain the next slide, cross it like this, like Jesus Christ on the cross of Calvary. Then you're going to pull it. So when you pull it, you are going to form a monolayer of cells on this slide. That monolayer of cells can be air dried and stained appropriately based on any other available staining protocol in that laboratory. That is for the case of SMASH technique. So in so doing, you're going to obtain a monolayered cells, or a monolayer of specimen preparation on your slide. Then you're going to stain it using any other available technique in your laboratory. Then finally observe under microscopy. Then we have another one which we call thin blood film. This is majorly for blood when you're going to perform cytology or study of cellular structures in blood. So in so doing, you're going to obtain still blood, put on this slide, then you're going to put this other slide at an angle of 45 degrees. Then you're going to run it forward. In so doing, you'll obtain a monolayer of cells on this other slide with majorly three major characteristics, where this one will contain the head, the body, and the tail. And majorly we air dry it and fix it. Then other histological procedures can be used for staining. Then majorly we can now examine it microscopically. That is thin blood film. Then there is another technique that we call a pull apart technique. What is pull apart? So in pull apart, you realize that I'm actually doing them with basic demonstration. With the pull apart, you're going to obtain the patient sample, put on the slide. After putting on the slide, you are going to put this other slide on top of this other slide. So in other words, you get your slide like this. From the frosted end, possibly like 0.5 centimeters, you get a drop of the sample, apply on this other slide, then you're going to obtain this other slide. So they should run together on the same plane like this. I see. They should all run together on this same plane. Then you're going to hold this one from this other side. Then you pull. That is what they call pull apart. So with the pull apart, it has got two advantages. One, you'll obtain a monolayered layer of cells on this other slide. But at the same time, you'll be making two monolayered slides. In other words, this one will also be a monolayer. This one will also be a monolayer. So you can now air dry and use either of them in order to diagnose these patients' conditions. Then we also have one we call roll technique. How do we perform roll technique? Roll technique, assuming this is a swab that you've obtained, maybe like the vaginal swab that you've obtained from the patient, and this is your slide that you have picked of choice with the patient's details labeled on it. So you're going to obtain it, put it on top like this, then you're going to roll this one on top of this slide as you keep moving it to the other end of the slide, and finally you leave. So that is what they call the roll technique. So with roll technique, it's majorly good when you have obtained the sample and it's maybe on the gauze or on any other on any other preparation, maybe like gauze or cotton, and you've obtained your maybe like wound swabs or high vaginal swabs. So you're gonna get it, put it on top of the slide and roll it on top of the slide. In so doing, that is what they call the roll technique. You'll be able to obtain cells on this other slide, you air dry it and continue with the other staining protocols for that study procedure to be done. Then we can also go out to the last one that we can call so the last one is the touch technique. How do you perform the touch technique? Touch technique, for example, this is your tissue that maybe they have cut from any other position from the body. And this is your slide. So you're going to make it touch. And after touching for a few seconds, you're going to pull this one off. So there will always be a cells that will remain on this slide. Then you continue. So that is the touch technique. Thank you. So just to let you know that most of these procedures can actually be examined. And so you need to be acquainted with them so that you don't mess up in an examination. This information is majorly for medical education and guidance. So I would advise you to follow the right protocols for sample collections and other staining protocols that can be available in your laboratory. Thank you so much for being part of this. I'll always be ready to bring out to you the best. Thank you so much.